just for better HCC surveillance.
And which one do you use in your practice besides the AFP and the ultrasound?
Yeah, so like I said, we could do better with HCC surveillance. So every time I order an AFP, I also order an AFPL3, which is a little bit more specific to the liver. We also, through EDRN, they validated another biomarker called PIVKA2, which is also known as DCP, which is actually what I hear
me
of.
that because I never heard about PIVKA3. I've heard the DCP, but not. Thank you.
Right. And so I also, in clinical practice, have heard it as DCP. And so now when I have an elevated AFP, if I have an L3 and a DCP, I can calculate something called a Gallant score, which then helps me risk stratify my patients, know the percentage, the likelihood of them truly having HCC, which helps guide which imaging modality I want to get, and also really the conversation with our patients, because liver cancer and that concern is, of course, can be a scary conversation, but when you go in with more confidence with these new biomarkers, it makes for, of course, better care and better conversations.
Absolutely. As a matter of fact, I utilize the same strategy. The only thing you got it more advanced than I am. I'm lazy. I don't do the Gallant score, to be honest with you. I just go to AFP, AFPL3, DCP, and the ultrasound. If I do see some elevation in the AFP, AFPL3, DCP, I don't see anything on the ultrasound. I do proceed with the triphasic CT scan or MRI with special dyes in order to contrast, in order to get a little bit more specific details on that. Do you utilize the same approach?
Exactly. So if ultrasound doesn't show anything and I still have these elevated AFPs, or be it an L3 DCP, we do typically first an MRI liver protocol, which is of course with and without contrast. And then sometimes I will use the CT triple phase. There are some patients who can't have an MRI, be it different devices, or sometimes claustrophobia really does limit these scans too. So we'll use a CT triple phase. But that, I would say, is one of the best looks at the liver. And I use that, of course, if I see these abnormal surveillance tests.